Hello everybody, here we go. This is the final video in this unit. So with arthritis, we will wrap up for our material for the test. So in this video, we're going to be looking at arthritis, what it is, what does the term rheumatic disease mean, looking at the three major forms of arthritis, kind of the cause, what goes wrong, and treatment options. What is secondary arthritis? What does that term mean? And then what is the overall effect of aging on the joints? So that's what we're going to go over here. So arthritis, that term literally means inflammation of a joint. And arthritis is actually not just one disease. It's actually more than 100 different diseases are classified as a form of arthritis. Arthritis is a rheumatic disorder. Rheumatic means anything that's going to be related to pain and stiffness with the skeleton or muscles. So arthritis is one example of a rheumatic disease. So arthritis, again, there's hundreds of forms. It's actually one of the more common diseases. Depending on the stats you see, anywhere from 1 in 10 to 1 in 7 Americans have a form of arthritis. And we'll look at the different types here in just a moment. Arthritis actually involves damage to a synovial joint. Ultimately, the cartilage in that synovial joint is going to be damaged and eventually destroyed if the treatment is not done. And even if there is treatment available, there could be some significant long-term damage to a joint. So arthritis is associated with pain and stiffness in joints, but the cause can be quite different. The causes can range from bacterial and viral infections to overuse to advanced age to metabolic disorders. All these things can cause issues with a joint. So finally, let me just say this, that some forms of arthritis are chronic, that you have those all the time, or in some form they may come and go. And some forms of arthritis are acute, where you have no issues and then you have an attack to where you have an acute form, a very painful, quick onset form of arthritis. So with that, what I want to do is just show you this slide and talk about some real basic differences here. This is a normal joint. Notice how we have our joint capsule, we have our synovial fluid, we have our two articulating bones, and we have articular cartilage on each of these. Different kinds of arthritis are going to damage the joint in different ways. In osteoarthritis, and we'll look at these types here in a moment, but notice how there is no more joint space. These bones are rubbing on bones, the cartilage is thin and basically gone, and that is one type of pain-generating arthritis. Another is where you have inflammation within that capsule. As you see here, this is going to be an example of rheumatoid arthritis, and that's going to have a very different cause. So, and I'll show you this one here before we go on. Another example is you actually can have some accumulation of crystals in a joint, as in this case here with gout. Uric acid, and we'll discuss that in a moment, can accumulate in a joint and basically limit joint movement and cause pain. So I want to stress here, arthritis is not a single disease. It is a sort of a blanket term, kind of like the term cancer is. Cancer includes lots of subtypes. So does arthritis. And you can see, though, in some forms of arthritis, you can get some severe deformities. It's not just going to be about pain and stiffness. It actually can cause deformities of those joints. So let's look at some examples here of different types of arthritis. And let's start with rheumatoid arthritis. RA is a chronic systemic inflammatory disorder. That is, it's an autoimmune issue where you're having an autoimmune reaction within the joints and it's causing the arthritis. As you see there, as with most autoimmune disorders, it's going to be far more common in women than men for reasons we don't totally understand. But what I gave you down here in terms of the pathophysiology is just kind of the chain reaction of effects. An immune reaction within the synovium, within that capsule, attracts neutrophils. Neutrophils are kinds of white blood cells. They release enzymes and they, in effect, break down collagen. They irritate the synovial lining. They cause inflammation and pannus formation. Pannus formation is fibrous tissue formation. And so if you start accumulating fiber inside the joints, you get edema from the inflammation, you get swelling of those joints, and that's why you get the reaction that we associate with rheumatoid arthritis. Um, it is marked with flare-ups and remissions. You may have RA badly for a little while. You may then get on top of it and not have the pain and stiffness, and then it can come back. It is suggested that bacteria cause this, viruses cause this, allergens cause this. We actually don't know. Again, the effect is an autoimmune disorder, an autoimmune reaction rather, takes over and causes the inflammation. So this whole thing is going to lead to the swelling and the pain and the deformity of joints, and it's usually going to be symmetric. That is, you'll have both wrists or fingers on both hands or both ankles affected by rheumatoid arthritis. It's going to be a systemic, that means a whole body disorder. That's often going to be bilateral. It will affect both sides of the body. Eventually, you can have so much damage inside a joint that you're going to have the deformities like you see here. These are going to be deformed fingers because of ongoing inflammation within those joints. How is this diagnosed? X-rays are helpful. You don't need to see an X-ray of someone's hand like this to know they have a problem. But if someone has a minor form of RA, X-rays aren't going to be that helpful. Actually, what would be more helpful will be to look at blood work, and you actually can see autoantibodies in the blood, which tells you there is some kind of immune reaction going on, and that's how RA is diagnosed. Medications for this include anti-inflammatories, aspirin, ibuprofen, steroids, things of that nature, which are going to try to reduce the inflammation reaction. I want to mention that there is a juvenile form of arthritis, juvenile RA. So please don't think all arthritis is about old people, but this actually is one that can strike kids. Again, it's a systemic autoimmune disorder, and you see there it's common in girls ages 2 to 5 and 9 to 12. It may actually somewhat subside in adulthood. Once again, we don't know what causes it, but once again, it's going to potentially result in deformities and pain and stiffness in joints because it's an autoimmune disorder. Osteoarthritis is the most common type of arthritis, and you can think of this as a wear and tear arthritis. This actually is an arthritis that we associate with overuse of joints or normal use but irregular or insufficient repair of those joints over time. So this is a chronic form of arthritis, non-systemic. That is, it's not affecting the whole body. It's going to affect that particular joint. So it could be unilateral. It could affect just your left knee or just your right ankle. And the pathophysiology for this, you see, is someone could have an injury, a genetic issue with joints, previous joint damage, obesity, and advanced age make this worse because with obesity, there's more pressure on certain weight-bearing joints. Advanced age, there's going to be more bone loss and more irregular bone development. These may stimulate chondrocytes to release chemicals. Ultimately, they are going to damage the cartilage. And that sounds kind of strange at first because why would they do that? There's a natural cycle of regenerating, breaking down cartilage and regenerating it, but it could be that over time or through advanced wear and tear on the joints, that process gets disrupted, so cartilage gets broken down a little faster than it gets made, and what you see here is the effect. This normal joint, normal knee joint here, notice this nice space between the femur and the tibia. Okay, here in osteoarthritis, notice how compressed the space is, and we also have a bone spur. Let me give you that term. Bone spurs are called osteophytes. So osteophytes actually are characteristic of many forms of osteoarthritis. So in fact, you can actually have these bone spurs develop to where you develop crepitus. Crepitus is a word that kind of sounds like what it is. You get the kind of the crunching of bone rubbing on bone or bone kind of catching on these osteophytes within the joint. and that's going to cause some pain and reduction of range of motion. So how would you diagnose this? This is going to be really classically diagnosed through an x-ray. You can see pretty clearly the reduced joint space and the osteophytes. A blood test here won't do any good. There's no autobody or autoantibody reaction here. There is no inflammation. It's going to be localized to that joint. So when you look at just a brief comparison of these two forms, osteoarthritis and RA is going to have a potential onset earlier in life. You can have that any time. You can be a person who's 30 with RA. You can be a person who's 11 with RA, as opposed to OA, which is going to be a later in life form of arthritis. RA is a chronic systemic disease. OA is a degenerative disease of a particular joint. With RA, you typically feel better as the day goes on because you get some joint movement there, and you may actually have the joints will warm and feel a little bit better. OA tends to get worse as the day goes on because you're getting a lot of pain with activity. The involved joints you see are symmetrical. In RA and in OA, they're going to be the weight-bearing joints of whatever is affected. And with RA, you may also have other signs and symptoms like malaise, fever, or anemia because it's an autoimmune disorder. It's affecting the whole body. There are no other signs or symptoms with OA except for the pain and stiffness that we associate with arthritis because it's not systemic. Again, let me emphasize one more point here. 25% of women and 15% of men over the age of 60 are going to have OA. It's not a natural process of aging, but it's a common process where over accumulated lifetime of wear and tear on the joints, there can be some damage that we associate with degeneration. And eventually, if that bone begins to rub on bone, that's the problem. For treatment for OA, it's really pain management. You may get some physical therapy, which can help some. If it's that progressive and that bad off, you may have to have that joint replaced, a knee replacement, ankle replacement, hip replacement, whatever the case is. Want to mention a couple other things here quickly here. Gouty arthritis. This is another form of arthritis. It's a systemic disease, that is a whole body disease. It's caused by the deposition of uric acid crystals in the joint and body tissues. Uric acid actually is a byproduct of some of our DNA metabolism. When there's a term here, purine. Purine is actually part of it's the bases that make up DNA. Some foods are a little higher in that, like oysters and liver and things of that nature. So it's possible that you could be developing gouty arthritis because you consume a lot of that. The more common cause is that you have irregular uric acid metabolism. This is a genetic cause, and because of that, you produce or you do not metabolize uric acid the same way everybody else does. Most people excrete it, they convert it to different forms, excrete it in their urine and get rid of it very easily. Some people, and I happen to be one of those, don't. So uric acid levels can rise, and when uric acid levels rise, they start to form these crystals, and then they get into these joints like this, and they cause some pretty bad pain. Just a quick aside, when the uric acid levels in blood should be between 4 and 8. When I was having some issues with my ankle and toe, and they found my uric acid levels were 12 point something. So I was way too high. Thus I had diagnosed with gout. So I don't know if this is true. I've heard people say this is true, that supposedly this is the most painful form of arthritis. This is about what it feels like. It is a very painful, acute form of arthritis. So you can go months and have no issue, and then if you're not managing the uric acid levels, they can accumulate. And a very common site of their accumulation, especially the first time, is this joint between the great toe, okay, between the first phalange of the great toe and the metatarsal, and you can get this accumulation of uric acid, and you can't move it, you can't look at it, you can't touch it. It is that painful. So you get the swelling and inflammation of the joint. You may get tophi formed, which are actually these deposits, and you can see them in lumps in people who have untreated gout. They may get these lumps that if they break open, they're kind of these gritty, crystal-like structures. Some people develop fever and malaise, body weakness and headache, and people who have gout have a higher risk for kidney stones because the crystallization of uric acid can also be a crystallization process that actually increases your risk of kidney stones. So, oops, wait, we're going too far. Hang on. How this is handled usually is someone who has medications to manage their uric acid levels, like allopurinol. You keep your uric acid levels from getting too high, and then you do not have these acute outbreaks. Or if you ever do have, if you do have an acute episode, it will not be nearly as bad. The goal of gout management is just to try to manage the chance for outbreaks. If someone does have an outbreak or an acute episode like this, then they're going to be given steroids to try to help manage that, and then once again get back on top of it with managing with the allopurinol or other medications which keep your uric acid levels lower. Finally, almost finally, I want to mention secondary arthritis. This is sort of a strange term here. There are other things that can cause joint inflammation that are not primarily joint issues, but are secondarily joint issues. Things like hepatitis, let me move me over here again, hepatitis, lupus, even inflammatory bowel disease can actually cause forms of joint pain and arthritis. One other one I give you here is Lyme disease. And don't worry about really reading all this, but I want you to see what's here in red, that somebody who has a tick bite and the bacteria that causes Lyme disease gets transferred to them may not initially, but later develop joint pain. And it may be difficult for a doctor to piece together that whole chain of events. If you have one of these characteristic rashes, and then later you have this joint pain, it's a sign of Lyme disease. Lyme disease is not bad on its own. Again, it's a bacterial disease that can be treated, but it's often difficult to diagnose because joint pain is just one of the symptoms. You can see how small a tick is, itty bitty. Finally, effect of aging on joints. As you can imagine, as we get older, our joints are not going to be as great as when we were younger. Tissue repair slows, so we develop new blood vessels more slowly. So therefore, repair of damaged tissue is going to be slower. The articular cartilages do wear down over time. Again, that's hyaline cartilage. It does wear down, and the matrix becomes more rigid. Rather than kind of nice and bouncy and supple, it becomes harder, and therefore it's more prone to be worn down. The production of synovial fluid declines, so the lubrication for the joint declines. The ligaments and tendons become shorter and less flexible, and therefore we see a decrease in the range of motion. If you're at the YMCA or if you're doing some exercising, you see a lot of people stretching, and a lot of older people in particular are stretching, trying to maintain some range of motion in those ligaments and tendons. Muscles around joints weaken, so the joints themselves are a little less stable. And then a decrease in activity as we get older causes less flexibility as well. So we know that even when people are elderly, any motion, any movement keeps their joints a little more active, a little more supple, a little more mobile, and helps maintain range of motion. Okay, that's going to do it for this video on arthritis. You may want to go back and make sure you can distinguish the different forms. Know how we treat gout, know how we treat OA, know how we treat RA, know the basic causes behind them, and that will do it. Mastering comes soon. Thank you very much.